Just 14, sorry, I just looked at it. I knew, yeah, we have an opening on the 21st, that was, so I got a little confused. So it's on the 14th, at 7:30. Just a quick show of hands, who thinks they would be able to attend that? Great, so we'll follow up with the logistics soon. Mike.
So next week, which is this coming Thursday, we have the Lunch and Learn with Rick Naylor, and Gene and I spent some time with him this week to learn more about the program that he has planned, and it's gonna be great. We have 2 slots still open, so we've got 20 people registered. We've got room for a couple more. Rick's got a great couple of hours planned. He's gonna talk about mission, values, just how to lead teams around strategies, tactics, table stakes, and we're gonna do some breakout work in small groups. And then we're gonna have lunch catered by City Barbecue, which is never a bad thing, and you'll also be able to have access to Rick if you have specific questions about your business or anything you're thinking about starting business. Anything else?
We have 2 students from the Entrepreneurship Institute at the Emerald coming.
Yep, some students there. We've got quite a few guests registered, so it should be a great time. If you're interested, again, we have 2 more people.
Yep. Thank you, Mike. Any other announcements? Susan.
I'll just do a commercial. This week I did Meals on Wheels. It was a little chilly, but I gotta tell you, it is so important to the folks that we're delivering meals to, because they really do appreciate it, especially when it's this daggone cold out. They just like to have any kind of visitor. So sign up if you haven't. It's not hard to do at all. Commercial.
Thank you. I know our sergeant isn't here yet, and I know he doesn't like to do happy bucks. Does anyone have any happy bucks? Hi.
As our daughters are called, one in Boston is pregnant and due in June.
Anyone else? Somebody's gotta have a happy buck.
I have a happy birthday.
Oh, please.
OH.
Well, how about if I read the introduction for a speaker, and then hopefully David, could somebody go snag David? Sara is our featured speaker today, and she's the Chief Executive Officer of Syntero, a leading behavioral health organization in Central Ohio. With over 20 years of experience in community mental health, Sara has demonstrated expertise in strategic planning, program development, and fostering collaborative partnerships. She began her career with Syntero 14 years ago as an outpatient clinician and has risen through the ranks, holding leadership roles such as Director of Youth and Prevention Programs and Chief Clinical Officer before being named CEO in August. Sara holds a Master's of Social Work from the University of Michigan and has been recognized for her leadership and dedication to making behavioral health services accessible to all, including the Helping Hands Award from the Delaware Moral Mental Health and Recovery Services Board. Passionate about promoting wellness and innovation, Sara is committed to advancing Syntero's mission to support the health and well-being of individuals, families, and communities, and creating positive change throughout Central Ohio. So without further ado, David.
There's something in the air today. I don't know what, but like I shortchanged Julie. Claudia walked in and I couldn't remember her name. That's how bad. So, and so I've already fined myself $1. We did not, I don't think we have any guests. Are there any guests today that are not on the list? Okay. No guests today, so we will move with fines. Now, somebody, I don't know who, but I found a pin in the raffle ticket box. Is that yours, Wolf? Okay, well, that's $1.
Oh, no, I have mine.
Does anybody else want to claim this for $1? I'm selling this back to somebody. All right. If you find you're missing your pin, I know it's gonna cost you to get it back, but I've got it. And speaking of pins, if you're not wearing a pin today, it's $1. And somebody informed me last week, Ron, that if it is illegal to connect your pin to your name badge. It goes against the rules. So if your pin is attached to your name badge, that's $1. Because you are cheating and that is illegal.
Fine page.
Yeah, page, that's $1. So the small pot today is going to be $20. The large pot is $3.74. And I'm gonna shuffle these up. I did tear 5 tickets that were not sold, so if we draw one that no one has, we will redraw.
All right, last 4, 1366.
1366. We have a winner? Okay, you want the small pot or the large pot? Well, the large pot, you get a chance to win. You have to draw the right card.
All right.
All right. So I'll come back in just a second and let you draw a card. So now we're drawing for the small pot.
Last 4, 1363.
Well, whoever came out to you. Or it could be the coach.
Got that one too.
We got a winner today. Okay.
All right, finally, without further ado, Julie. Not Julie. Sarah. It's so hard for me to be awake in the morning. I just gotta.
No, you're fine.
So, anyway.
Good morning. Such an honor to be here to talk about Syntero, our programs and services. This is an organization that I think is near and dear to many people in this room's hearts. And I'm just honored to be here to be able to share information about our programs and services. So as many of you know, Syntero has been around for over 45 years, providing behavioral health services in Central Ohio. We started in Dublin and Upper Arlington with Dublin Counseling Center and Northwest Counseling Services. And those two organizations merged in 2013 to form what is now known as Syntero. We provide a wide variety of services across the continuum of care to support people in improving their wellness over their lifespan. One of the things that I want to highlight, and I'm not going to go over all of these statistics and they may be hard to read and I'm happy to share them with anybody that would like them, but the mental health needs of our community are continuing to increase. Even prior to the pandemic, in the decade prior to the pandemic, the percent of Ohio adults who are experiencing poor mental health days increased by 20%. And we also know that in a survey that is done by the state of Ohio with school districts in Ohio called Oh Yes, that 37% of kids reported feeling sad or hopeless every day for the past 2 weeks, which was an increase from 26% prior to the pandemic. So for both adults and children and adolescents, the need for mental health services is continuing to rise. I do want to just highlight, this may be a little bit of a trigger warning for those of you who have been impacted by suicide. The Franklin County Suicide Prevention Coalition just released their 2024 report, and it's showing that we continue to struggle with the loss of individuals in our community to suicide. One of the populations that is most significantly impacted is older adults. And I want to highlight that because there are some programs that we are doing to really try to address that and to provide services and resources to older adults in our community. And that is one of the programs that I'll be highlighting today. So Syntero, often when people think of Syntero, they think of, I go to the office and I get an assessment and then engage in counseling or other kinds of services to receive care. But Syntero offers services across the continuum of care. So we're not only doing treatment services, but we're doing whatever we can to promote mental wellness in our community through public education campaigns, through articles that we submit to the Healthy Dublin magazine, to promoting strategies that people can use to manage the stressors in their life. In our school-based services, we're providing services that are considered to be prevention services. So we're trying to work with children and adolescents to help build the coping strategies they need to reduce the likelihood of them developing a mental health or substance use disorder condition. We also do provide that treatment level of care, and then we have lots of programming around recovery support. So once somebody has graduated from treatment, we offer support groups and other resources to be able to help them with sustaining their recovery long-term. I'm not going to highlight all of the different programs and services because there are quite a few different areas that we focus on, but we do have services across the lifespan. So we work with early childhood all the way through older adults. Some of the programs that I want to highlight that are dedicated toward serving youth in our community is that outpatient mental health and substance use treatment services. So we provide individual services as well as services for the family. We do provide group-based services as well. One of the groups that is considered to be evidence-based to help adolescents with building effective coping strategies to manage life stressors is called dialectical behavioral therapy. And that group is offered out of our Dublin office. We also offer psychiatry and medication management services and case management services where we're able to go out into the community and meet with kids either in the schools or in their homes to help them build the strategies and get connected with the resources that they need to support their wellness. One of our newer programs is an intensive outpatient program where we are providing support for individuals who have more serious mental health or substance use concerns to be able to get a higher level of care while staying connected to their schools and communities. So many intensive outpatient programs do require a child or adolescent to leave school and to attend that service during the day. Syntero's program is designed to be provided after school hours so that kids can stay connected in their school settings. So typically when adolescents are engaging in that program, they're coming into the office 3 times a week for services that are up to 3 hours each time. So 9 hours of service a week for 4 weeks total, and then they reduce the frequency to 1 time a week. So we're doing more intensive services to help them build the strategies they need to reduce those more serious mental health or substance use concerns. I'm going to highlight our school-based prevention and treatment services on another slide, but we are actively providing services in the school districts within our community. We also are the crisis provider, the youth crisis provider for the Delaware community, counties. We work with kids in schools that are experiencing a crisis or they're able to come into our office so that we can do risk assessments and get them linked with care quickly. Because access to care is one of the most significant challenges that our community is faced with. Trying to get in for services, it can be very difficult. So we're able to link with kids immediately. We also have been piloting a same-day access program out of our Lewis Center office where children and adolescents can walk in for services and receive care immediately. So we know that when a family is reaching out for services, the last thing they want to hear is, I'm sorry, I don't have any availability, or we have a 6-month wait list, which is a message that many people are receiving. And so we've been fortunate to receive funding from the Delaware Mental Health Board to be able to pilot that walk-in program. And we've just started that this past July. And at this point, we've seen almost 50 youth that have walked in for services, and we've been able to continue to get them linked with care. So we're really excited about that program. Yeah.
It's dialectical behavior therapy.
So dialectical behavioral therapy is an evidence-based clinical intervention. There's 4 modules. Your individuals that are engaged in DBT services are learning about emotional regulation, interpersonal effectiveness, mindfulness, and distress tolerance. So there's specific skills that we're teaching around building the strategies they need to manage life stressors and the mental health symptoms that they're experiencing. So those are the 4 modules, and it's a very specific evidence-based approach. So there's a curriculum and a guide. So each module typically is 4 different sessions of learning skills related to interpersonal effectiveness, distress tolerance, emotional regulation, and mindfulness. Any other questions about services for youth? I'm happy to take questions throughout. This map highlights kind of our geographical footprint in central Ohio. So each of those little Syntero logos represents where one of our offices is located. So we have an office in Hilliard, in Dublin, in Lewis Center, and then very top of the map, you'll see a Mount Gilead, Ohio. That is our newest office. We also are providing school-based services for 12 school districts across 3 counties. So the school districts that we provide school-based services for are listed there. Dublin City Schools is one of the districts we've been providing services for the longest. We've had a partnership with them for many, many years, but have been heavily invested in providing services with Dublin City Schools since 2013. We also have contracts to provide services for Toll's Technical and Career Center, which does serve many students from Dublin City Schools as well as Hilliard. And we have a contract with Ohio Virtual Academy, which serves 23,000 kids across the state of Ohio, K through 12. We have a contract with Trucka, which is also a virtual school, where we're serving students virtually through that program as well. And we have a partnership with Ohio University's Heritage College of Osteopathic Medicine, their Dublin campus, where we have a clinician on site 3 days a week that is providing services for medical students at OU. So we're very invested in doing what we can to help individuals in our community build the skills that they need to manage stressors and to reduce the likelihood of them developing a mental health or substance use disorder later in their life. So most of our school-based services are really focused on that prevention lens. Yes.
The uncolored counties or areas on the map, do they have similar services available through another situation? Except the state of Ohio is completely covered by service?
Not necessarily, no. In Franklin County, the Franklin County Alcohol, Drug Addiction, and Mental Health Board, which we refer to as the Adam H. Board, is the levy-funded board that provides services for Franklin County residents and school districts. The Franklin County Adam H. Board has funded for every school district in Franklin County to get school-based services. There are different providers that work with different districts. So we work with Dublin, Hilliard, Upper Arlington, and Grandview Heights. And we are also funded by the Delaware Morrow Board to provide school-based services in all 4 of the Delaware County school districts and all 4 of the Morrow County school districts. But there are many school districts across the state of Ohio that do not have access to the same level of services that we are providing. So there definitely is an increased need. School districts did receive a lot of funding through the federal government with COVID funding through ARPA grants to be able to expand mental health services. And some of that included partnerships with community mental health agencies. And some of that, the districts did fund hiring and employing their own mental health professionals. So, Any other questions? All right. For programs for adults, I'm not going to go through the entire list, but we have very similar programs for adults as well. So we're providing that non-intensive outpatient therapy service where somebody is coming into our office for care 1 to 4 times a month, or they may be able to access services through telehealth. We do want to be very hands-on and person-centered in our approach to care. So we do ask that clients come in for their initial appointment in person, but they are able to continue to access care through telehealth services if that is easier for them. So we want to do whatever we can to reduce barriers in helping people get access to care. And the expansion of telehealth services has really helped us meet the needs of individuals because they're able to not need to take as much time off of work or other things to be able to access that care. We also provide that DBT group, and we provide an anger management group. Often those are individuals who have some kind of court or legal consequence related to something that occurred and they may be court ordered for care. And so we do provide a group-based service to help them fulfill their court requirements. I'm going to talk more about our partnerships with first responders and Goodwill in another slide. So I'm going to explain those in a few minutes. One of our big focus areas, as I said earlier, is providing services and support for older adults who are living in our community. So we are funded by the Franklin County Office on Aging and the Adam H. Board to provide what's called aging supportive services or intensive outreach. So we're able to go into the homes of older adults. We are assigned 12 zip codes within the northwest quadrant of Franklin County, so that does cover the Dublin community, to provide those aging supportive services. So an older adult qualifies for this service just by being age 60 or older and living in one of our zip codes. They do not need to have a mental health or substance use disorder to qualify for this service. But we are able to send a community support specialist into the home to be a friendly visitor, to provide social and emotional support, to help them get linked with the resources and services that they may need to be able to stay in their homes independently for as long as safely possible. So that program, we've invested a significant amount in that program and building relationships with community partners to ensure that we can meet the needs of older adults so that they can stay in independent living for as long as possible. We also recognize that the caregiver stressors related to taking care of an older adult or someone that has significant healthcare needs or medical needs can put a lot of stressor on individuals and on families. So we are funded to also provide caregiver support services, and that is for anybody who lives or receives care in Franklin County. So it can be an older adult that is a care receiver or a family member that is a caregiver. One of those two parties needs to live in Franklin County to qualify for that service, but we are able to meet one-on-one with those individuals to provide resources and support. We are offering caregiver support groups as well because we recognize that there are some significant stressors related to being a caregiver. We do partner with the City of Dublin to be a part of their Forever Dublin program. So that program is a big initiative across the city to provide the resources and supports needed to help older adults age in place safely in the City of Dublin. Our role at Syntero is to provide a hub and a navigator where individuals can come to access services and resources. So we have staff on hand that are able to talk one-on-one with any individual that's living in Dublin that wants information about a variety of topics and resources. So our job is to really identify what are those needs and what are the services and available resources that we can help get them linked with. We've also been able to provide educational presentations and other services to help older adults with navigating them.
Like, how do they find out about you? I mean, quite a lot of those folks don't even know what or who Syntero even is or how to reach out to you.
That's a good question. We've worked really closely with the City of Dublin, and actually Claudia helps with a lot of our marketing and the website specifically for Forever Dublin. But we've been doing marketing campaigns. There are some videos that the city has been putting out on their social media channels and support. When we're offering educational presentations, often that's at the library, so we're putting up information there. And we found that when we do a good marketing push, we are getting more calls and then it tends to die down. So raising awareness around this resource, I think, is definitely something that we've been working with the city on. Barb, I saw your hand first.
A different slight topic, but are a lot of the services covered by Medicare, Medicaid, and private insurance from people, or not really mental health services?
So Medicare is the primary payer for older adults, and they do cover treatment services. They do not cover case management services. And often, depending on the plan, there may be copays or deductibles, co-insurance that individuals have to pay. So the services that I'm describing are free for older adults that live in Franklin County or in our zip codes because they are funded by the grants that we receive.
Back to children, how do parents, what are the symptoms that parents should be looking for with children with mental health problems?
So the question is, what symptoms should parents be looking for children who may have a mental health concern? One of the things we like to look at is a change in functioning. So if a child is moving along fairly well and things are pretty typical, then we wouldn't be concerned. But if they've had days where they're not interested in attending school, where there's declining grades, where their mood is low, where they're more isolated or withdrawing from friends or family members, or not as interested in participating in activities or things that they used to enjoy. And if that persists over a period of 2 weeks or more, that would be an indication that we may want to get some support. So that could be an indication of something like depression. Or if there's significant worries or anxiety, difficulty with being able to focus or sustain attention, or experiencing physical sensations of stress or anxiety or worries, those would be some things as well. But we ultimately are looking on that impact on functioning. Are they still engaging with friends and family? Are they doing well in school? Are they still participating in sports? If they're still doing all of those things and having bad days once in a while, that would be considered pretty typical. But if they're withdrawing from any of those other activities or experiencing what we call functional impairment in any of those areas, then that may be a sign that somebody should reach out for support or help. Any other questions? All right. The other things with older adults is we do provide connections groups. So it's 55 and plus connections group through rec centers and then through Forever Dublin. So it's an opportunity. One of the biggest issues facing older adults is social isolation and loneliness. And we know that that contributes to long-term health concerns as well as mental health concerns. So we want to do whatever we can to keep people socially engaged in their communities. And so we offer opportunities for people to come together with support and education groups throughout. Usually it's twice a month that we're offering those groups. And then we do provide mental health treatment services in Delaware County through a partnership with SourcePoint. So we're able to go into the homes of older adults to provide treatment services for individuals who are not able to access care through an office setting. It is a limited resource and there is a high need, so we really try to focus on providing that service to older adults that cannot get into one of our offices for care. And then another program that I want to highlight is our substance use disorder program. So one of the theories around providing support for individuals with substance use is meeting individuals where they are. So we focus our program around what's called the stages of change. So if you start at the bottom of the graph, when an individual is in pre-contemplation, they're not aware that they have a problem. So some of the information that we put out into the community around just raising awareness and education around that is helping people to identify, maybe I do have a concern and I may need to get some help. As someone's moving into that contemplation stage, they're aware of the problem, but they're not quite sure if they're ready to go into a treatment program. So we have programs called SUD education, where it's just learning about what is an addiction, what are the concerns or risks associated with long-term substance use. And then we have a program called Exploring Recovery. What would it be like if I were to enter into a recovery program? A lot of times we're working with individuals who have had some kind of a legal or professional consequence associated with substance use. So they've been referred for services or an assessment, but they may not be ready yet to engage in that deeper level of care. And then as people are moving into that preparation phase, they're ready to take action, ready to engage in care. They're moving from exploring to recovery to outpatient or intensive outpatient programming. And then when they're in that action phase, they're learning the skills and practicing the behavior of being in recovery. That's when they're in that outpatient or intensive outpatient program. And then as they move into that maintenance stage where they're in recovery, we want to continue to provide support long-term to reduce the likelihood of a relapse. We have relapse prevention programs and sober support programs. One of the things I think is a lot of times when people think about Syntero, they think about our office-based services, but over 50% of what we do is out in the community. We're going to the homes of people, we're meeting clients where they are. That's our older adult programs, our school programs, and we also have case management and other programs going out into the community. So case management is a program where individuals can get linked with needed resources and services to help them be able to meet their basic needs like housing, food insecurity, clothing, furniture, other things like that, other kinds of benefits to help them be able to then focus on improving their life and their quality of life. In order to qualify for that service, the individual does need to have Medicaid or qualify for sliding fee services through our funders from the AdamH Board of the Delaware Moore Board. We have partnerships with Goodwill, Columbus to provide a clinician on site to be able to support adults in that program with being able to build the skills they need to engage in long-term sustainable employment. So we're teaching them emotional regulation skills. We do an adapted DBT program with those individuals to help them learn the strategies they need to sustain in that long-term employment. And we've done education for the Goodwill staff and for employers who employ Goodwill participants to help them build a culture that is supportive of these individuals, a safe and trauma-informed employment setting and work setting for those individuals. And then we work with Buckeye Ranch and Franklin County Children's Services to provide therapy services for adults who have had children removed from their care related to abuse or neglect. Our job is to help those adults be able to access the care they need as part of their care plan to be able to reunify with their kids. And Buckeye Ranch provides the services for the child, and then we work together as a team to help support that family. And then Renew is a program that has gone through some changes. There was some significant impacts due to workforce during the pandemic, and we're in the process of rebuilding it. But it's a program designed to support transitional age youth, so individuals ages 18 to 25 who have experienced an initial psychiatric hospitalization, to provide wraparound supports to be able to reduce the likelihood of them going back into the hospital. So we also partner with other organizations, Concord and Southeast, to provide counseling services, psychiatry services, case management, and vocational rehabilitation. One of the things that I love about working for Syntero is when bad things happen in our world, we have people that run towards those bad things to provide help and support. We have staff trained in what's called critical incident and stress management and psychological first aid, which are specific interventions designed to support individuals who have experienced a traumatic event to reduce the likelihood of that event turning into post-traumatic stress disorder. So we have staff that will go in to schools following the death of a staff member or a student to provide debriefings for the teachers or administrators to help guide them in developing a plan to help those students and other staff that are impacted by that loss be able to understand some of the common reactions to experiencing a trauma and the strategies for being able to get through that trauma in a way that reduces the likelihood of that turning into a post-traumatic stress disorder. This is something that we've been doing for many, many years, and sadly, we've had lots of responses over the years related to different experiences that our community has faced. But I love when somebody can call and say, "Hey, this event happened. What can you guys come help?" And we have a team ready to go to say, "Yes, we'll be there." And we've done that for churches, for businesses, and for schools for many years. One of the programs I wanted to highlight, because this has been a focus area of ours for the past several years, is our partnerships with law enforcement. So you may not realize this, but individuals that work in law enforcement are more likely to develop mental health or substance use concerns than the general population. They are also more likely to die by suicide than in the line of duty. Knowing this, we've been doing a lot to increase comfort and reduce stigma around accessing mental health services. So we have partnerships with several different law enforcement entities to provide mental health support to individuals at their offices. So one of those programs is called GRIT, stands for Growing Resiliency Intentionally Together. And this is a program, we have several partnerships listed there. This is a program where sworn officers are required to meet with a mental health professional 1 or 2 times a year for 30 minutes to an hour to talk about whatever they want to talk about. So it reduces that stigma in accessing care and provides that access to everybody. So individuals can come in and talk about the stressors of the jobs, or they can talk about what's going on with their families or other things, but it's an opportunity to meet with a mental health professional to try to take away that fear of what it might be like to meet with somebody, and also just to receive education and awareness about the supports and resources that are available. Often people will say, "I don't need this, I'm doing fine." And we'll say, "That's okay. You may have a colleague that could benefit from this." So what are some of the signs or symptoms that you may want to recognize in a colleague? And what are some strategies you could do to help encourage them to reach out for care? So we've received a lot of positive feedback from the participants in these programs. And as word of mouth spreads, we've been able to expand this program and are in the process of building this program for Hilliard Police as well. I'm going to highlight a newer program that we have called the Public Services Safety Liaison with Dublin Police. And then I just wanted to let you guys know that one of our key staff members, Susan Ortega, does and has for multiple years sat on the Dublin Police Chiefs Advisory Council. So we're able to provide that mental health perspective to the police department as they're working on community initiatives. And I know I'm running out of time, so this information was provided directly from Deputy Chief Tabernick from Dublin Police about our partnership with Dublin Police and now Washington Township Fire Department. So they fund Syntero to provide a mental health clinician that is embedded in the police department and now the fire department to be able to provide responses to individuals that have had some kind of a contact with fire or police related to a mental health or substance use concern. So we receive referrals directly from the police officers or fire department to follow up with individuals when they've had a call related to that. The goal of this program is to reduce the likelihood of the police needing to get called back out to those homes and to help improve the likelihood of those individuals being connected with services. So this information was shared directly from Dublin Police Department about the benefits that they've had. We've just finished up our first year of services with Dublin Police, and so we had 158 referrals. We receive referrals from all shifts. So the graph that you can't read really well just kind of looks at what shifts are we getting those referrals from. So first, second, and third shift. So we're getting referrals from all of the shifts from law enforcement. And the reason for referrals are listed there on the slide as well. So often it's getting connected with mental health services, could be connected to needing access to housing resources or food resources, financial assistance. So our job is to identify what those needs are and then help work with that family until they're effectively connected with the services that they need. Any questions about that program? All right, so there's lots of ways that we're committed to the city of Dublin specifically. We were founded in the city of Dublin and we continue to make sure that we are connected to the community. That's one of the things I value most about Syntero. As you saw through all of our different programs, that we really value partnerships and we recognize that we're in this work together and that it truly does take a village to make a difference in the lives of an individual. So we do whatever we can to be very connected to the communities that we're serving. This is just a list of some of the things that we're doing within the city of Dublin to be a support. We are an agency that's identified as a safe space. So any individual in Dublin can walk into Syntero and say, I need help, and we're gonna help get them connected with services or resources or get them connected with the police department if they have something that would require police attention. I've talked about a lot of the other pieces here. We have done some programming with Dublin Arts Council, and that's really exciting. And we are the fiscal agent for the Dublin Act Coalition, which is a youth-led coalition designed to reduce the likelihood of youth engaging in substance use. And then the city of Dublin has been going through a community health needs assessment and developing a strategic action plan. So Syntero has been involved in the first two, the youth behavioral health work group and the healthcare navigation work group. So we are part of those focus groups, work groups helping to provide feedback and support as the city is identifying strategies to support the residents and continuing to build a healthy Dublin. And then I just want to thank you all for your support. Rotary has been a huge supporter of Syntero for many, many years through sponsorship of our Catalyst event and through buying gifts through the Adoptive Family Program at Christmas time. And there are multiple individuals in this club specifically who have had personal commitments to our organization through board service or employment services or consultation with us. And so I just want to thank this club specifically for all of your support of Syntero. Are there any other questions? Well, thank you.
Sarah.
Sarah, just a question over Zoom.
So thank you for everything you do to serve the community and our club. So we really appreciate all that you do.
Thank you.
So instead of our traditional closing quote, I thought I would share a personal story about Syntero. So 2.5 years ago, I was in a pretty serious automobile accident. That was my fault. And I was 100% sure it was safe to do what I was going to do until it wasn't. And the second thought that came to my mind immediately was, oh my goodness, I've done something to hurt someone else. And so I knew that if I didn't deal with that it was going to linger inside me and manifest in ways that were not at all positive. So I reached out to Syntero and was fortunate to be able to be connected with a great resource who helped me process that and ended up with what you see today. So they do a great job, but they don't work miracles.
Thank you. Thank you.
So our meeting next week is the annual club meeting. Please plan to attend. It's not going to be a PowerPoint brigade. We're going to split up into tables. Yeah. And so you have a chance to meet with, to get updates on finance, the different avenues of service areas. So it hopefully will be very interactive. And you can walk away with a handout that summarizes the activities of the other tables you're not able to join. So look forward to seeing you next week. Have a great week. Take care. Thank you.
Take care. Thank you.
Yeah.